Yeah, hi. This is Dr. Prakash here from I Want Second Opinion. This is a group which essentially has been formed for offering second opinion for people who are in needy, especially for those who have already got a first opinion and are not having any good clarity in what exactly has been happening, or want to get more information on what advice has been offered, or if they have got any difficulties in making the decision-making process, then you can write to us at iwantsecondopinion@gmail.com and we will get back to you. Now, I have got today Miss JB. JB is a counselor based in India. It's a totally new field. I have roped in JB because she's a close friend of mine. Hi, JB.
Hi, RP, and hello, everyone.
Hi. JB, you are a counselor. I do not know much about what exactly counseling means. Could you please tell to us, think me as an Aam Aadmi or a general public, and let me know what exactly is counseling, please.
Yeah, RP. So, see, first, before starting the discussion, I would like to state that whatever I say here is my personal views and my opinions based on my experience in this field.
Yeah.
Yes, and I would have changed. So today, if if I have to say what counseling is, I would say it is a safe space that we offer to a client to process, to explore their own difficulties, their issues in a non-judgmental, in an empathetic, in a confidential space. So when you get into a therapy room,
so they come and confide to you. They tell all about.
They come with an issue most of the time. Yeah. They want to explore something. There is something that is limiting them. Okay. So what we offer them is a safe, unconditional, non-judgmental, confidential, empathetic. Maybe all these sounds like huge big words. Maybe in the sessions, in the discussions, we'll be able to say what it exactly means practically, right? Yeah. So in this environment, what happens is the client gets an opportunity to explore and maybe discover or find ways to live life maybe more satisfyingly, more resourcefully, more in charge of their life. They feel more empowered. This is, they feel more in control of their life. Right. This is the whole, I would say, an agenda like that. They find their own solution, their own.
Okay, you guide them towards their decision making.
Facilitate. Yeah, the whole thing is we facilitate. So the client, in the therapy room, it's only the client. Okay. So we're just there to facilitate with various approaches and tools.
Okay. So what exactly do you do in counseling, and does it involve one session or many sessions, or how long does it take?
So it varies, like it can't be, we can't very specifically say. There are some approaches and tools which are a lot more solution focused and goal oriented, so which can get over in like 10-15 sessions. Okay. And there are like I do something which is a combination of talk therapy. So when I say counseling here, right now I'm addressing more of a talk therapy. Yeah. Right. And so I do something which is a combination of talk therapy, which is called brain working recursive therapy, and some other intervention. That is also, some of them are faster. Okay. But some of them are like, equally effective, but may take longer. And sometimes the client, client wants to continue and, come up with different issues that they want to do. So based on different approaches and tools that we use, yeah, it's different. Some of them are just, like I said, BWR.
Variable depending upon the conditions, I gather.
Condition and the tools that we use. Okay. Yes. Okay. So some of them, even with the condition, some of them are very fast. Like this BWRT is relatively faster if it works for the client. Okay. Okay. And it's a combination, like you said, maybe the condition and the tools and the approaches. That
I can relate to that. Yeah. Okay. So how do people contact a counselor? For example, if I need counseling services for my own reason, are there any groups, or how do they approach, or is it a publicly, openly available service?
So in India, you do have groups, and it typically works with word of mouth. You know someone who's in the field. That is one way. You feel you are limited and you really feel you need to see a doctor, then if you go to a psychiatrist and if he prescribes counseling, most of them do. If they find and if they evaluate and find a condition. That they are either giving medication or sometimes they feel only counseling help. So we have groups that this is how it works for me. Like, I get from those groups inquiry.
All right.
And then the client, because it's very confidential. So it just, certain words are written like that's all. And the number is then passed on and the client contacts. So that is one way of doing. So typically for me, it happens with my experience. It generally happens mostly with the organization from the psychiatrist, and there are different counselors groups. So from there. So if you are a client, if you really feel, then nowadays what I see in India is from friends, from Google search. So there are many headlines. So there you go, and then from there you get to know, there they give you a list of either counselors or organizations.
Right. Okay. Right. Now, early in the conversation, you mentioned about some medical jargon regarding the ways or approaches and the tools that you use in the counseling. In your practice, which approach or tool that you commonly use, or how do you do that?
So I typically predominantly use an approach called person-centric approach. Person-centric approach, and I use various tools. So in this person-centric approach, what typically happens is the client is, like if you have to say in a jargon, the client is the king. So we believe client knows his issues. He's an expert of his life. And I just facilitate that. Facilitate him to manage his issues. So facilitation happens mostly in this approach by reflection and by encouraging.
Right. Okay.
So this is what I typically do, and all these approaches and tools, I would say all of them they all work, which is very common to all the approaches and tools. One common platform, that is a platform of empathetic and understanding environment. So I repeatedly emphasize that because this is something which is, I would say, an essential ingredient which needs to be there in all the sessions, an understanding and empathetic environment, which we also call as a therapeutic alliance.
Therapeutic alliance. Okay, that's the terminology that you use. All right. Okay. You use three terminologies to begin with. One was confidentiality. Second is empathetic, and the third one you mentioned was non-judgmental, if I'm not wrong. These are the three important words in counseling. Am I right in saying that? Is it, or am I?
Empathetic environment, and like the approach that I follow specifically, and person-centric, it's very important. All these, I would say, if it's a talk therapy, it is important in all the sessions. It's an essential ingredient if a client needs to look out for, if he feels he's not understood. If he feels, he's getting judged in the session, then he needs to wonder what is going wrong. Maybe he's not in the counseling space, or maybe it's not happening for him. So what you're saying is, what does it mean, right? So this, like I said, I use person-centric approach, and I use a lot of tools like CBT, REBT, DBT, quite a few.
CBT and?
CBT, REBT, DBT.
What is REBT?
REBT is rational emotive behavioral therapy. CBT is cognizant behavior therapy. So these are all They all are predominantly talk therapy, and I also use BWRT, which is said is a combination of talk and an intervention, which is brain working recursive therapy.
So you do interventions as well, is it? Is it a kind of a physical intervention, or is it only through communication?
Yeah, it is more a psychology-based, evidence-based therapy, where we just like, just do a small fast talk kind of a thing, which is like, so the client is fully aware. It's not that fully aware, and he knows what's happening. So in this, so in all these approaches, in all these tools, what I'm getting to is all those words that you mentioned, the empathy, so that is the most important thing. So what otherwise counseling becomes an advice or a solution. If it has to be whatever I said, the client needs to feel empowered, he needs to feel his own solution, then you need to have that alliance.
King is king. Patient is king.
Patient is king. Yes. Very truly, whatever you said, like customer is king, patient is king. That is where. So we just actually get into the therapy room. We have to leave our frame of reference and get into the world of the client. Then it works better.
The happy hour for the patient. Yeah.
Sorry.
The happy hour for the patient. They feel that they are in control. Yeah.
They are in
control. Make them feel they are in control.
Yeah, they just feel heard, basically. They feel, heard completely and understood.
Yeah.
So, like I mentioned, there are various tools and approaches, but in all these, like I'm again and again reiterating, what the client needs to feel is he needs to feel he is understood. Yeah. Right? So, if a client comes to me, like if I have to explain this, and he comes with a problem, I can, with my life experience, and I've seen it, and with whatever he says, okay, I feel this will work for him, that will work for him. If I give a solution, he may even be happy with it. It may even work for him, but that is not counseling.
Right. Okay. Yeah, I understand. Okay.
So, what is different? So, if I say advice, what is not counseling is giving advice, giving quick solution, saying, oh, this happened to me in my life, I can tell you how it works. So these are all not counseling.
Sure.
For counseling, it is about getting into the world of the client, understanding what he is going through when he's stating something. What is there in his mind? What are his thoughts? What are his feelings? What is he behaving there?
Yeah.
So to get into his frame of reference.
Sure.
So, and how does how do we do that?
Right. Okay.
Right. We all have our own thoughts and our own, we want to get into it. We judge. So how do you do that?
Okay.
So that is the thing of like, you listen to him.
Okay.
You reflect. Like I said in the definition of person-centric, you reflect.
Sure.
You sense this is what he's feeling based on the environment that you actively listen.
Yeah.
To start with, you actively listen about like it's verbal is maybe say about 30-35%.
Sure.
The rest of it is body language, how he moves, how he is. So you really need to be very attentive.
Sure.
And once he, so you get back to him, you sense what he is feeling, and then you reflect it back to him.
Okay.
And check with him, is this what is happening? Is this how you're feeling? This is what your situation is.
Okay.
So this is what I mean by empathy. Empathy is, it's very different from sympathy. It is you just put yourself in the shoes of the client and feel this is what he might be feeling, and then reflect it back to him. So that, connects him. Either he sometimes disagrees also. Sometimes he'll agree, sometimes he'll disagree. And then you will be, okay, what are you feeling then? So it goes like this. So it becomes his space. And then in this platform of alliance or understanding, either a CBT or an RBT or a psychodynamics, or there is a, transaction, any of those tools are used, then whatever emerges, whatever awareness comes, whatever that gets processed, whatever feeling, it is all his own. It is his solution. It is not my solution.
Okay. All right.
So this is what is, and then it is sort of, it's something that has changed within him. Otherwise, there is one problem, you come to me, and then the next problem comes, you come back to me.
Oh, yeah.
Right? So this can keep happening. So if you really want to change, then it needs to be your process of what is happening. Maybe it is something in childhood, or maybe it is something in, what's happening. Maybe as a child you didn't have the resource, but as a 25-year-old, maybe you have a resource. So these are the things that gets explored. Then it becomes his own solution. So this is what I want to put it out there. This is what is counseling.
All right. Okay. That's been fantastic, really, JB. I learned a lot about what exactly the counseling means. Just before finishing of this session, we have been talking in generic about what counseling is. Can I be a little bit intrusive and ask one thing, what your specialty is, like what sort of clientele you get, and are there any age relation there, or any gender specificity, or is it more urban biased or rural biased? How clientele, and what do you specialize in?
So I get clients, the issues more or less, like quite a few of them different. I mean, wide range of them, like, depression, anxiety, and trauma, grief. So, but if you are looking at what is predominant, I specialize. I do get a lot of relationship issues. So I also do family and couple therapy. So I focus more on emotionally focused therapy there. So I get a lot of relationship issues. It's relationship means it's not only husband, wife, or boyfriend, girlfriend. It's also like, father, son, mother, daughter, or family. Yeah. So those issues is what a lot of them they approach for. They feel stuck in relationship, and then it gets deeper into whatever that is like. So it can be what they come up the presenting difficulty, if I have to say. So that gets presented quite a bit. And since it's become, I do a lot of online, and online counseling has helped, I think, the rural India quite a bit, especially the educated rural India, because they get access through Google. They can pick up, like, any of the numbers and the helplines. So that helps quite a bit, like, so that is why I have quite a few from rural also. Rural in the sense the second tier, like, cities. Not only the urban ones, definitely. The younger ones I have more. If I have to look at my pattern, is what I'm saying. The older ones, the younger ones, I have more, and they approach easily. They call up. They even come with very, which are not exactly something majorly limiting them. If they are stuck in something, they want to take help.
All right. Okay.
Taboo that is there, that is like they are open about, oh, I have my counseling. Even in the work, they say, oh, I have my counseling session in the morning. So I need to. So they are okay with that in India. But the older one, like I would say, maybe beyond 50, it's still not that easy. So I get them mainly if there is a psychiatric prescription, like, if somebody has referred, or if their daughters or their sons are pressurizing them, then it lasts unless and until they believe in it. And some of them, I have one who's like, quite a bit. So once you get into that alliance, then if it starts working, then they really want to be there and work on themselves. So this is about my clientele. So I say I focus a lot on relationship. Like I said, I do a lot of couple and family counseling.
Fantastic. JB, thanks a lot. It is awesome. And thanks for giving an insight about what you do. It is a humanitarian thing, great humanitarian thing that you are doing. I'm sure it's only a tip of the iceberg, possibly. And thanks a lot. And I look forward to seeing you in other sessions in the near future. If you are going to give some more time to me, I will look forward to see you then.
Yeah, sure, Arpi. We can definitely look at a lot of other things related to counseling.
Yeah.
So, thank you.
Thanks for joining me. Wonderful day. Bye-bye.